Welcome back to part 2 of Contraindications. First up is ferromagnetic foreign bodies in the static field. These are likely to be contraindicated for the same reasons as implanted devices, this being the risk of movement due to translational and rotational forces. The risk is particularly prevalent in areas where movement of the item has the potential to cause hemorrhage or damage to delicate anatomical structures. And for this reason, special attention is given to screening patients for intraorbital foreign bodies. Let us look at a few examples. So high-velocity ferromagnetic fragments have been known to penetrate the globe of the eye. And in at least 2 cases, they have interacted with the static field, resulting in unilateral blindness. In one case, the damage was irreversible due to a vitreous hemorrhage, and in the other case, the injury was treatable by the implantation of a prosthetic lens. In regards to these risks, what is the procedure for screening intraorbital foreign bodies? How do we go about it before a procedure? So let's explore that. All patients who report having suffered a penetrating eye injury should be considered for plain radiography if no recent imaging is available for review. However, the procedure for screening such patients is subject to a degree of controversy. One being that the radiographs deliver a lens dose and that the combined cost of negative examinations can be very costly. Remember the examples we gave in the previous slides? Let's see how those happened. In the case of permanent blinding, the patient was unaware of the presence of the metal fragment. Hence, the MR scan was done, which unfortunately led to blindness. In the second case, the patient knew about the fragment. Radiographs were obtained, but were reported as normal. A decision was made to progress with the scan, and the resulting injury pulled a 1 mm steel fragment from the lens of the eye into the anterior chamber of the globe. The resulting trauma led to the formation of a lenticular cataract over the months following the scan. What lessons can we draw from this? One is that patients should be screened for intraocular foreign bodies, and 2, the patient's verbal history should be respected as much as their tick box responses on the screening form. Again, all patients who report having suffered a penetrating eye injury should be considered for plain radiography if no recent imaging is available for review. The next contraindication is claustrophobia. Claustrophobia refers to the fear of enclosed or confined spaces. For individuals with claustrophobia, undergoing an MRI scan can be challenging due to the enclosed nature of the MRI scanner, which resembles a narrow tube or tunnel. The close proximity to the walls of the scanner and the need to remain still during the procedure can trigger anxiety and panic in claustrophobic individuals. In some cases, claustrophobia can be very severe, leading to extreme distress, difficulty in breathing, rapid heart rate, sweating, and even fainting. These reactions can make it challenging for the individual to complete the MRI scan successfully. In such situations, the anxiety and discomfort may outweigh the potential benefits of the scan. It's important to address claustrophobia as a contraindication. This is because attempting to proceed with an MRI scan without proper management can compromise the well-being and cooperation of the individual. There are a few strategies that can be employed to help individuals with claustrophobia. Let's look at those. One is the use of open MRI scanners. These are an alternative option for individuals with claustrophobia. The scanners have a more open design with a larger bore and less enclosed feeling. The open configuration can help reduce anxiety and provide a more comfortable experience. The second remedy is sedation or anesthesia. In cases of extreme claustrophobia or anxiety, sedation or anesthesia may be considered. Administering a sedative medication can help relax the individual and reduce anxiety levels during the scan. This approach requires careful monitoring and should only be done under the supervision of a qualified healthcare professional. The third remedy is the use of distraction techniques. Providing distraction techniques can be helpful in managing claustrophobia during the MRI scan. For example, individuals may be given headphones to listen to music or offered visual stimuli such as videos or images to focus on during the MRI procedure. Last but not least, we can use communication and support to ease the tension. Clear and open communication with the individual before and during the scan is very crucial. Explaining the procedure, addressing concerns, and ensuring that the person feels supported can help alleviate anxiety. The presence of a supportive and empathetic healthcare professional can also provide reassurance during the scan. The next contraindication that we look at is body weight and size. The size and weight of a person can affect their ability to fit comfortably inside the MRI scanner. The weight limit of the table and the size of the scanner's bore should be considered to ensure patient safety and optimal image quality. Next up is severe renal impairment. In certain cases, the use of contrast agents during MRI scans may be contraindicated for individuals with severe renal impairment. Gadolinium is a contrast agent commonly used in medical imaging procedures such as magnetic resonance imaging to enhance the visibility of certain tissues or blood vessels. While gadolinium-based contrast agents, or GBCAs, are generally considered safe, they can pose a risk to patients with impaired renal function. When gadolinium is injected into the body, it is primarily eliminated from the body through the kidneys by urinary excretion. In patients with normal renal function, the kidneys efficiently filter and excrete the gadolinium from the body. However, in individuals with impaired renal function, the kidneys may not be able to adequately eliminate gadolinium, leading to its accumulation in the body. The accumulation of gadolinium in patients with impaired renal function can result in a rare but serious condition called nephrogenic systemic fibrosis, also known as NSF. NSF is characterized by the excessive production of collagen. Now, collagen is a fibrous protein which can cause thickening and hardening of the skin and other connective tissues throughout the body. This condition can lead to significant disability and, in severe cases, even death. The exact mechanism by which gadolinium triggers NSF is not fully understood. However, it appears to be related to the inability of the impaired kidneys to clear the gadolinium effectively, allowing it to remain in the body for a prolonged period. It is important to note that the risk of developing NSF is highest in patients with renal impairment, such as those on dialysis or with end-stage renal disease. Therefore, to mitigate the risk of nephrogenic systemic fibrosis, it is recommended to avoid using gadolinium-based contrast agents in patients with impaired renal function unless the benefits of the procedure outweigh the potential risks. Alternative imaging techniques or non-contrast MRI may be considered. Please note that if you have any concerns about gadolinium usage or its potential risks, it is advisable to consult with a healthcare professional for personalized advice based on your specific situation. And that brings us to the end of this contraindication series. Thank you for sticking with me. And if you enjoyed learning with me in this video, please consider giving it a thumbs up and subscribing to this channel. See you on the next one.